A woman, I'm sorry. I have the light in my eyes, I'm sorry.
No problem.
Sorry.
My name is Cristina Guerrero Pais. I'm from the Dutch Breast Cancer Association. I was wondering, Fiorita, do you also have some information about breast reconstruction? Because we know that in the Netherlands that was really delayed during COVID.
The same everywhere.
Okay.
This was considered an elective procedure, which is, at some point it is. If you think it scientifically, we have a decrease. I don't know. I don't have numbers. They are not published yet, but we have a decrease in reconstructions. And also, we have this information from the industry where they sell the implants and the tissue expanders. That's what we have been discussing with them. They had no orders for during the pandemic.
Also a very large group of hereditary breast cancer patients.
No prophylactic mastectomy.
They stopped at all.
Stopped everything,
Yeah,
yes, absolutely.
Okay, yeah. And at the end, for Barbara, you said that almost all screening is back to normal. In Netherlands, it isn't. We have a huge problem with finding people to work at the screening facilities now. So it's still up to 13 months. It's not 2 years. And what we also have noticed is a decrease of 5% of attendance for women to go to the screening because of more fear than before. Have you any information on other countries?
Look, you have to keep in mind that when we do our surveys, we're asking our national leaders like you. So it's not a scientific-based survey. I didn't go into some of the details. So in the actual survey, there are some countries, and I believe that, if I'm not mistaken, the Netherlands is one of the ones that said that screening has not gone back to normal, because we know that not all countries, and also in just here talking to some of the advocates, I know Violet from Turkey said that they have the same problem. Women are not, they don't have a population-based mammography screening program, and women are not going because they're still afraid to do it. So I think our jobs as advocates is to continue with the communication portion and telling women that it is safe to go to screening, you need to go to screening. So it's not, our data is not perfect because it's not, you know, scientific based, and it's based on an advocate's perspective. But, you know, thank you for, you know, for bringing that to, you know, to our attention.
Well, thank you.
Thank you very much for this very interesting question. And it is true that we have to push in every country women to go to their screening because if a cancer is found smaller, it has a better issue than later on, and the treatment is also easier for the surgeons and the oncologists. Do we have other questions in the room? I have one for our 3 members. Barbara almost answered the question before I asked her, but for Fiorita and Sylvia, if there's another pandemic, let's say in 5 years from today, what would you do differently from what you did before the first pandemic? What has changed in your, what would you do differently?
Dealing with the patients or personally?
Well, mainly with the patients. Personally, it's.
I think now we have some resources that we didn't have before. For instance, the psychological support, at least in Lisbon, in our center, was exclusively in person. Mm-hmm. So it's not possible to give online support, which is important to, for instance, palliative patients that could not move or have more difficulties moving themselves to the institution. So I think we have reorganized our service, and that we do in a future, and I hope this will not happen in a future pandemic, I think we will be more secure about our methods and about our ability to still provide support to the patients.
Mm-hmm. And I would probably encourage and organize my patients more to use telemedicine in order to decrease the fear, to face some problems and some questions they may have. I would organize a telemedicine consultation system and probably increase more the use of the neoadjuvant endocrine therapy as a bridge until the peak of, hopefully not, next pandemic will go down.
Good?
Can I actually just comment on something from Sylvia's presentation? Because I think what struck me, if I understood all of your data correctly, was that really it was only the quality of life that had an impact with the COVID. And I think that what you said was right, because we all had to stop. You couldn't go anywhere. You were forced to, stay at home. I actually was the most active I think I've ever been, because every morning I would go for 3 kilometers in my road. I would go up and down and around and, road, because I did Pilates online every day because you had the opportunity to do that. Whereas when, you're going about your normal life and you have to commute to work and whatever, you don't have that time to do that self-care that I think helps anybody in general, but also somebody who's going through treatment, because those are things that you need to be able to, get through your treatment. So, and I think that one of the big lessons I think a lot of people have learned from COVID is it's caused everybody to change the way that they do look at their lives. And so I think it's also helped people that don't have cancer to reevaluate, their lives in a way that they probably never would have that opportunity unless, they went through something like this.
So whether it's with cancer or without cancer, it's called adjustment.
Yeah.
And I think we all had to
flexibility. We've all learned to be flexibility.
We have all learned to be flexible, to adjust, and to take the better things of what has happened to us and suffer through the bad things. But I think adjustment and flexibility is the right attitude. Thank you very much.
Thank you.
We have no questions from outside, and apparently,
we have one more
question from the room.
Just to say, it's been a fantastic table, and I would like to ask Sylvia, do you think the role of information about the COVID could influence the situation of your patient? At the beginning, there was no information about the disease, the consequences, and then it was increased. If it had a positive effect, and also the role of the vaccines, it also has a positive effect on the emotional status of your patients.
If I understand correctly, you are asking me if giving information helps.
No, at the beginning there was no information about the COVID, the consequences, the limitation, and also I think it was progressively we have more information. Also, patients receive more information of the symptoms and consequences. And also at the beginning there was no vaccine. And
yes,
now,
at the beginning.
Do you think both things could have a positive effect in the results, in your clinical work, in what you see, and also in the results of your study?
Yes, I think so. We have included patients at different times of the study. For instance, patients right after receiving a cancer diagnosis can participate in the baseline of the study during a peak of COVID incidence, and also a patient that is finishing the first year after diagnosis can be participating in the study in a moment with very low COVID incidence. So it is difficult to control to these variables. But I think that it could be an explanation.
Yeah, that maybe there was more information about the negative or positive consequences.
Yes, during
and maybe help to cope better, no?
Okay. Yes, thank you.
Thank you very much.
So we call it to an end, and thank you very much for our three wonderful speakers.
Thank you, Nicole.
Thank you.